It was very difficult because some of the CHW, I can say on the academic, they didn't go like so far like to tertiary levels.
They need to know how to write, how to do BP, how to do HIV screening, STI, all those skills.
We were not doing okay because we don't know anything.
We are working, but we are not aware about what we are doing.
I think they were having a little knowledge on what is it that they are supposed to do.
Like a BP machine, we don't know much.
We were taking BP, but we were not having enough information how to take BP.
Like BP of 160 over 70. They don't know, is it normal or is it abnormal?
On the medication delivery, we did not know who to deliver to. We were even delivering for those who are young.
We didn't know when they say follow up the patient, what is that follow up?
We were struggling a lot. Misunderstanding card, the road health card.
We didn't know the stationary card, what to look at on those pregnant women cards.
We are not organized. We didn't have books where we are writing our notes. We didn't record the patient's information on the correct papers.
They didn't refer the patient, and this we're having struggle of the stats.
The stats, they didn't know anything about the stats.
So really, I think even themselves, they were not clueless. They were clueless on what is that they're supposed to do.
The relationship between the CHWs and the clinic staff was not good at all.
There was no relationship at all before the measurement to come, because they were doing as they please.
They would go out at 9 o'clock to do the household and deliver some medications. At 2 o'clock, they knock off.
There was no, the enforcement on how to go about. You must report back to the clinic, you must bring the stats to the clinic, you must knock off at 4.
We didn't know our scope of work. Yes, we were all over the place.
We'll have this conflict thing, the CHW and the facility.
It's many things. When you want to file that time, the files are missing.
We were bad previously.
Everything we were doing, it was useless to them.
Because they bang us involved in these things.
They don't take us as a part of a clinic.
They were not treating us well. We as a CHW.
They were just seeing us like nothing.
They were not having the resources to take to the community.
We were lacking equipment, BP machines.
We don't have any glucose machine. Skills we don't.
Sometimes we don't have batteries for BP machines.
They don't have gloves. They don't have mask, and you decided on our own. I don't go there because I don't have material to go there.
What I can highlight is that the community did not recognize us. We never got respected.
If you talk to them, they don't listen to you.
People were not taking us seriously. So we were doing referrals. People were not coming to the clinic.
The houses, they found them locked.
They closed their gates. It's our challenge. They told the clinic the wrong address.
So if we go there, we don't find them.
Here at the clinic, they said we don't work, and we are working. The problem is the community, because they don't want to come to the clinic.
We face these challenges.